Yeah, thank you very much for the invite today. I'll just share my screen with you. How do I, is it on full screen now? Yes, it is, isn't it?
It is, yes, okay.
Okay, so I'll just start off with talking a bit about what is occupational health. So occupational health is concerned with the impact on work. Oh, my screen's disappeared. Can you all see it?
Yes.
Yeah, okay, it's disappeared for me, sorry. Okay, so the what is occupational health? So occupational health is concerned with the impact of work on health and the impact of health on work. And on screen, you can see what the definition is by the World Health Organization. So it's the promotion and maintenance of physical, mental and social well-being of workers in all occupations by preventing departures from health, controlling risks and adaptations of work to people and people to their jobs. So occupational health has been historically interpreted as a negative, but recent thinking is more positive. I think this is because more people have a better understanding of what occupational health is by now as well. So work on health, there is a legal duty to control hazards to minimise harm. That's where the health surveillance, fitness to work, musculoskeletal training kicks in. We all know that evidence show that work is good for physical and mental health. And employment is associated with poorer physical and mental health. There are more mortality, morbidity and suicide. Re-employment improves self-esteem, improves general and physical mental health, and work, well, good work can be therapeutic. The beneficial effects of work are greater than the harmful effects of long-term unemployment or prolonged sickness absence. So health on work, from an employer's perspective, healthy staff are more productive and are less likely to take time off work. And an unhealthy workforce impacts on our economy due to long-term sickness and obviously healthcare costs. So there are 131 million working days lost due to sickness absences every year. And the main reasons for sickness absences are musculoskeletal and mental health. So our OH role prior to the COVID pandemic, these are just a list and I'll just talk you through them. Fitness to work, these are medicals carried out for our safety critical workers, such as our traffic officers and road workers. We have a health surveillance programme such as the audio, Spiro, skin assessments and HAVs. These are mainly for various members of staff, but the highways and municipal more so, and as well our external companies, Anglesey Council and ADRA Housing Association. We'll deal a lot with sickness absences where staff are referred to us either by their manager or through self-referrals. We have a flu vaccination programme for our eligible staff members. Health promotion programme is something that is run throughout the year by carrying out various health checks, stress talks. We also carry out the public health campaigns throughout the year as well. Ill health application is something that we also coordinate within the OH department, and we have seen an increase in ill health applications during the pandemic. So how COVID has affected our work. So we didn't do face fit testing prior to the pandemic, but this is something that is carried out now for our carers, especially with AGPs. We also established a system for COVID results of key workers, especially at the beginning of the pandemic. We saw an increase of key workers not receiving their test results. So we worked with the health boards just to make sure that the key workers were receiving their test results accordingly. We've also created a support package for staff members and managers just by sharing information about COVID, any support that they should know about. COVID vulnerability risk assessments, I'm not sure if you're aware of this, but this is something that we carried out and are still carrying out on our vulnerable and clinically extremely vulnerable staff members. We follow the ALAMA framework, which is a framework that's been created by occupational health physicians in order to provide a clear guidance and advice for managers prior to staff returning to work if they needed to stay and continue working from home. And there is a traffic light system basically scoring them from low risk up into very high risk. We have seen an increase in OH referrals, more musculoskeletal and mental health. We have seen obviously an increase in physio and counselling referrals. This is obviously due to the increase in musculoskeletal and mental health referrals. We are unfortunately seeing a lot of staff members suffering with long COVID. This is something new really that we don't know much about at the moment. Obviously, prior to COVID, we were seeing people face to face, but there has been an increase in telephone assessments and Teams consultations since the pandemic. And health surveillance were carried out by paper screening, and if there were any issues within that paper screening, they received a telephone assessment. Luckily now we have started to see health surveillance face to face and also the medical as well. So this is a bit of information, really, stats from our OH referrals over the past 3 years. So as you can see, the referral intake for our occupational health departments was 541 in 2019, and it has increased to 625 up until now in 2021. You can also see the increase in musculoskeletal mental health referrals during the past 3 years as well. And then we also have our physio referrals, where we had 143 referrals in 2019 to compare with 207 now in 2021. We have seen an increase in physio referrals due to people working from home and they might be struggling, and also an increase in our driver loaders struggling because they find the work more manually, since a lot of people have been working from home. We have seen an increase in referrals from that department as well. And to say it politely, we might be a mop-up service for the NHS as well, because we have been receiving referrals through GP services and NHS physio who have been telling staff members to come through us because they are continuing not to see all individuals on a face-to-face basis at the moment. So what are the overnight changes created by the pandemic? So obviously, following the government's guidance, most of us are home working. There have been an extension in working days. Blended working hours becoming the norm. There has been an increase in our workload, and not just us, but everyone, I think, across the board. A lot of people are struggling with loneliness. I think this is for people more so who are maybe living alone and who depended on the social interaction of being in a working environment. A lot have been struggling with loneliness. We also have the social pressures on workers with childcare issues and elderly care. And obviously the health conditions not seen to due to the demand on the NHS. We have a lot of staff members currently still off sick due to waiting for operations or outpatient appointments because of the NHS at the moment. So what does the future hold, COVID and beyond? So obviously, because the workforce is changing and there is an aging population, many people now are working into old age. So there is obviously a delay in retirement, and due to this, there is an increase in chronic diseases within the workforce. We have also found that research is showing that people aged 50s and 60s are more likely to provide informal care. And at the moment, I think evidence shows that 1 in 4 female workers and 1 in 8 male workers are providing informal care. Obviously, long COVID, we don't know what the impact will be with long COVID, and I'm sure research will be continuing for the future. And then within Gwynedd, obviously there is a project in place looking into the hybrid model of flexible working. Mental health training for managers as well as staff and team leaders. Mental health continues to be a priority within Gwynedd. And I think it's important for us as an OH department to continue the provision of treatment for musculoskeletal and mental health issues and to deliver continuity and consistency. Thank you very much. That was just a quick glance, but I'm sure you'll have a lot of questions for me. Thank you.
Thank you very much, Hav.
Welcome.
I'll sort of field a couple of questions while Gwenan is taking a look at the chat box. And we've got plenty of time left, by the way. If anybody wants to submit questions on the chat function there, we've got plenty of time. My first question for you, Hav, is, and maybe Gail, who's on the line as well, can answer this. What sort of is the demarcation between your role and corporate health and safety's role? I realise that some of the members who might be on the line have smaller organisations who might not have that split, or they might just have one health and safety person in charge of both aspects. I just wondered if you could just make some comments really on the split between you and corporate health and safety.
We're one team. I wouldn't say that we are split, and we do communicate effectively and we work well as a team. More so, I think, during the pandemic, and I think Gwenan and Gail and whoever else has joined us today will agree with that. So I don't think that there is a split really. Yeah, we do work effectively, and yeah, we communicate effectively as well, especially with our health surveillance programme. And we are currently looking at a project now with the driver loaders, especially with the Roma quips and the shoulder pain and the musculoskeletal injuries. So obviously occupational health and health and safety are working together really to make sure that the staff out there are protected.
Are you
Oh, sorry.
in the same
I was just going to add to that and say it's the same with something like a risk assessment. So maybe a risk assessment linked to somebody's health condition or a workstation and risk assessment. If that's advised by occupational health, managers then often come to the health and safety team for advice on the content of the risk assessment. And I think personally, I think there's been a lot more working together on those sorts of assessments during the pandemic as well. Sorry, Gail.
No, I was going to explain that situation that you just did very well there, but also just going back to what Hav said with regards to the small project that we've got on the go. We've actually with the bin lads and the loaders and stuff that have some musculoskeletal issues arisen. We've actually got the physiotherapists to come in as well. That's through the occupational health. So we're getting other people involved that may have different aspects and look at different things to us that we can incorporate into the health, into the risk assessments, and just try and find different options. So instead of just thinking inside the box, we're also thinking outside the box and trying to get involvement and consultation and everything in with that as well.
Quite interesting to hear. Are you members of the same departments then?
Yes,
we are.
Right, because Wrexham Council do things slightly differently, as I mentioned earlier on. I think Occy Health there are in HR, whereas corporate health and safety are within finance and within the audit team, partly because they wanted some independence, I think, of the health and safety team. So that's quite interesting. And we also, in terms of Occy Health, we do externalise our service as well. We've got a consultancy working for us to do all our Occy Health work. So. Okay.
I think one of the benefits of having a team that's quite close and working together is obviously we have to be careful with information that's shared, but it is possible to ask, you know, the individuals that come in if they're happy to share information with us. So being able to get more information to do a risk assessment makes it makes it a more robust risk assessment, if you like. So from that point of view, I found that very beneficial.
Quite surprised at the size of increase of OccuHealth referrals, in that I was expecting it to be such a large spike. I just wondered if Gail or Harv could comment on that.
Yeah, it's unfortunate really, but a lot of staff members, and I think this is across the board nationally, that more people are suffering with mental health issues, musculoskeletal issues. So yeah, we have seen an increase in referrals. As well, I discussed earlier, the loneliness, the social aspect as well, that people have become carers or they've got childcare issues, and that obviously adds on to the stress if they've got lots of stuff going on at home, as well as work. Yeah, so I think it's across the board really that there has been an increase in the amount of referrals.
Yeah, I think that's reflected in some of the work the health and safety team are getting as well. I do get quite a few, because the amount of workers we're allowed in the office is limited. I do get a lot of requests from managers saying, can this worker work from the office, because they are feeling lonely, they are feeling isolated at home. And it is difficult, because if they are in the office, because there's so few workers there, doesn't really make much of a difference to the loneliness side of things. So that's a very difficult one. At least I suppose they get some sort of routine and getting up and going to the office, but I don't think it helps as much from a loneliness perspective as people might expect. So it's a difficult one to be able to help with. I don't know if you find that, Harv. It's a difficult one.
I think what you just said, Gwen, and that routine, some people that although that they walk into an empty office, they do get that routine of actually waking up and going into work instead of just maybe working by their desk in the kitchen and not seeing anyone. So yeah, it is a difficult one, but we do try and manage and try and help the symptoms that they have and try to alleviate it as much as possible, really.
We've got a few questions coming through, so I'll start with Joanne's question, and I think maybe Gail and I might want to come in this one as well. What are your thoughts regarding DSE assessments of home workers with the increased requirements for working from home? So usually I think your team would refer any DSE requests to the health and safety team.
Yes.
Am I right in saying that?
Yes. So sometimes we do get self-referrals or management referrals, and then within the reports we would signpost them on to health and safety for further assessments. Yeah.
Personally, I find it very difficult to work out if the setup's okay through Teams. I do tend to ask people to have somebody else take a photo of them at their desk working, so that I can see the angles and the setup from the side, because it's difficult to work out over Teams. In some cases, I would say if I do my best over Teams and recommend a few things, and then I ask them to come back to me if that doesn't work for them. And I think I haven't come across the case yet, but I think I would go down the road of going to see them if I really couldn't work it out over Teams. Don't know whether that answers your question, Joanne. So if you need more information, pop it in the chat for us. Francis is asking, is there an occupational health resource available for commercial organisations in Gwynedd and Conwy? Are you aware of any places they could go?
Occupational health resource where we would go for further information, do you mean?
I'm assuming, unless Francis wants to come in and...
Yeah, we do. Obviously, Dr. Oliver, our occupational health physician, he's always there for resources. We do talk a lot with Flintshire County Council as well. Not off the top of my head otherwise. Sorry, Francis.
I think what Francis might be asking is, do we offer occupational health to other commercial organisations?
Oh, yes, we do.
Council?
Yes, I touched on it quite quickly earlier. We do for Anglesey County Council, Adra Housing Association and Snowdonia National Park, but we also carry out for ad hoc services as well. Sorry, I misinterpreted the question.
Yeah, so did I think. Sorry, Francis. I've got one question as well. How do you feel about the more telephone and online appointments and inquiries? Do you think staff are less willing to engage and open up to you in that digital way as compared to face-to-face appointments? And does that make things more difficult?
Yeah, this is an interesting one. We recently did research within our occupational health department where we asked the customers or the employees how they felt about telephone consultations and face-to-face, and the answers were 50-50. Some were happy to come in, and others, especially if they live in rural areas, they prefer the telephone assessments due to the travelling. In regards to the assessments that we do, it can be hard sometimes to engage with staff who aren't ready to open up. And I think it's easier sometimes when you see them on a face-to-face basis that you get that rapport with them. But we are trying to see, especially mental health assessments, we do try and see them on a face-to-face basis. But we do sometimes have staff who are willing to engage as well, but it is a difficult one. It's 50-50 really, depending on the situation.
Okay, so we've got a question from Richard for Harv and for anybody else in the session as well. Has anybody noticed a correlation with geographical location, for example, staff living in remote rural areas, exacerbating work from home loneliness? So yeah, I guess if you live in a city, you can pop out and maybe see people on the street, while in a rural area you might literally be alone. Has anybody noticed difference? Tav, we'll start with you.
Yeah, we have seen an increase in people suffering with loneliness, not so much rural areas, I think across the board, especially if they live alone. And I touched on it earlier that they miss out on the social interaction of working in an office environment when they depended on the conversations and stuff. And now when they're working from home, they don't really see anyone. And we've had feedback saying, you know, usually before, if all the team members were in the office, you had that banter, didn't you? And you were able to discuss stuff. But when you're at home now, it's not as easy to phone somebody on Teams and asking a question, maybe they're in meetings as well. So I haven't noticed it in more rural areas. I think it's just across the board, really, within our council, really.
So it's more of your personal living situation more than the area you live in.
Yeah.
I mean, I could say from a personal perspective, I live alone, and it's not just a work issue, it's a personal issue as well, because from a personal viewpoint, before COVID, you would depend on going to see family, going to see friends, going out with friends, and people are a lot less willing, a little scared of gathering in groups. So it's a double whammy, if you like, at work and at home, isn't it? So it's
definitely
a double issue. I think I've got one. Christine say that she finds in her workplace people who live alone find working from home difficult, although people with children have found working from home and childcare very stressful and difficult to manage. Yeah, I'd agree with that. I don't know how people with children have coped. I'm trying to work and especially younger children, trying to look after them at the same time. I can imagine it's extremely stressful. Has anybody else got any questions or comments?
I've got a couple. Have you mentioned that obviously mental health conditions have increased due to COVID? What sort of avenues are there for an employee to raise these issues or get support themselves? You mentioned one route would be self-referral. Are there any other sort of routes, and how do they compare in terms of numbers, and do those numbers and routes change according to what the condition is? Let's say there's a haves condition. Would a self-referral be more likely to happen there, or than mental health? I presume you've got different avenues of referral.
Yeah, halves wouldn't be self-referral. That would be manager really with risk assessments in regards to halves and stuff. And obviously we would signpost them on to our occupational health physician for diagnosis. In regards to mental health, they can come either through a self-referral or through sickness absence, where their manager would refer them. We sometimes get HR staff referring staff members who they are concerned about. What was the other question? Sorry.
I just wondered if there were different avenues were more popular for different conditions.
Yeah, so we do signpost them on to different organisations. Really, we've obviously got the counselling service within the council. Obviously, if we are concerned, we do signpost them on to the GP. We've contacted GPs in the past as well if we are really concerned about individuals. We signpost them on to the COVID support package that we have. The Silver Cloud is another app that's available for staff members. So yeah, there's various routes really where we can refer them on, depending on the condition really, or their symptoms. Yeah.
And you mentioned long COVID. What's your gut feel in terms of numbers or percentage?
We have a small bucket of staff at the moment suffering from long COVID. Yeah, especially in the adults department, care workers, we've got a small pocket of them not being able to return to work, and we've got 2 teachers at the moment as well, who are not able to come back to their 100% capacity within their roles due to extreme fatigue and shortness of breath. And this is by having a COVID test last year. So this has lasted months and months on end. They are unfortunately waiting for a respiratory appointment, but obviously with the NHS at the moment, they have been on the waiting list for months. So we don't really know what the impact is going to be, but I'm sure that the research that is being done at the moment will continue for some time.
Thank you. I've got another question in terms of other inoculations and vaccinations, things like Hep B and what have you. Do you get involved in those? Did you actually deliver those yourselves, or is that done by external providers?
Yeah, flu vaccinations is something that we did do ourselves in-house, but there was a problem really with the geographical area where we were having people not turning up or not being able to reach them due to their shifts. So for the past 3-4 years, we have been providing them with vouchers where they can attend any local pharmacy for their vaccinations. So we can coordinate that programme on a yearly basis. And in regards to Hep vaccinations, we have been looking into this of doing it in-house, but it is a massive project, again with geographical locations as well. But at the moment, they do attend the GP service for their vaccinations, and obviously they get that back then. Well, the department pays for the vaccine, or first sources the vaccination funding.
Is that the same with tetanus as well?
Yes, that would be the same with tetanus. Yeah.
Our Occupational Health provider does daily webinars for staff on various topics. I'm just wondered whether you do something similar or you source something similar.
Yeah, we have been doing webinars on stress for staff members and managers. That is something that we have been doing during the pandemic and before as well. We have also arranged an outsourced Andrew Tamplin, I'm not sure if you're aware of him, but he has been carrying out sessions for managers and staff members as well, providing support. Yeah, so it's a mixture of both really.
On smoking cessation now, do you you deliver that yourselves, so support for that, or is that again an external service that you?
Yeah, we've all done the smoking cessation training, and that is something that we do provide advice on for staff members. And I was talking earlier quickly about the health promotion activities we do. We try and do a campaign each month, really, where we target if it's smoking, alcohol awareness, know your numbers, blood pressure awareness week. So we do various public health campaigns really across the year, and we sometimes target as well the workers. So say that if we do find an issue within a certain department, we'll work with that department then. If we've got stress levels within that department or musculoskeletal, we'll try and work with the department. Yeah.
Okay, thank you. And on a similar vein, on the pun, drugs and alcohol testing. Just wondering what you do in relation to that.
Yeah, we in occupational health don't actually carry the drug and alcohol testing itself. It's done by the health and safety team, but it's for cause that we carry it out. And then obviously occupational health provides the support for individuals who are struggling, but it's the health and safety team that actually go out and carry out the test.
It's just similar to what you were saying earlier, Nick, about a bit of independence, because occupational health tends to help with the support side. Basically, we discussed it and we thought maybe the testing should be apart from that, if you like. And so the health and safety team do alcohol breath tests. We outsource the drug testing. At the moment, we're outsourcing the alcohol ones as well, because the health and safety team, similarly to the occupational health team, has been a bit overwhelmed with COVID-19 work. And so, but this is just a short-term thing that's outsourced. Gail, I don't know whether you want to add to that.
Does Occy Health then get involved in supporting the employee in terms of addiction?
Yes, we see them offer support, and then we signpost them on as well to CAIS or various other support networks. Yeah, but we do support them. Yeah.
Just a question coming in about the counselling. If we outsource the counselling, do you want to just feedback on that first half?
Yeah, so the counselling service is Medra service that we use for our counselling service. So it's not actually in-house. We do have a contract in place with Medra counselling service.
Yeah, a little bit different to maybe other councils or other organisations. We have to we do supply all our information in as a bilingual service for Welsh and English services. So we have to make sure that the services that provide us with the service can also do it through both the medium of Welsh and through the medium of English as well. So sometimes that can be a little bit difficult, but in North Wales it doesn't seem to be such a bigger problem than in other areas.
How do you deal with your eye tests and hearing tests and sort of stuff that's done at induction? I presume there are quite a few various different health aspects that have to be addressed with Occy Health at induction.
Yeah, so with our safety critical staff members, I mentioned earlier, our traffic officers and road workers, they receive a medical. So we have a contract with Specsavers, so they have their eyesight tested in Specsavers, and we just get a report then from the optician confirming if they've met the what they should meet anyway. And then in regards to the actual hearing test, we do the hearing test ourselves. Yeah, we provide the audio checks within our safety critical staff members role anyway. Yeah.
Okay, good. Any other questions? I think we're going to be calling on Occy Health an awful lot more with hot desking and that sort of thing that's going to be coming in. We in Wrexham Council have got a modern way of working initiative, which means that, well, prior to the last fortnight, we were going to be doing introducing a third of our office workers are going to be working in the office, a third will be working at home, then a third will be working out on site or doing visits, what have you. So that's what they were going to be. That was the aspiration until a couple of weeks back, but of course that's taken a bit of a back seat now with what is happening. Just wondering what your thoughts are in terms of that for the future, how that's going to impact on your service.
Yeah, I think that occupational health have come a long way to compare with years ago. And I think we were occupational health was being concentrated on ill health years ago, and now it's more on well-being as well. And I think that's important. Moving forward in regards to the hybrid model, yeah, I'm sure there will be an increase in referrals and stuff as well, because it doesn't work for everyone. A lot of people have been referred with musculoskeletal due to their working environments not being fit for purpose, really. But yeah, to be honest with you, my personal opinion is I prefer to work from the office than being at home, but I think everyone's got their own opinion on it. But yeah, it is something that is going to create a lot of referrals, I should think, in the future.
Well, are there any other questions from the floor or comments?
I've got a comment unless anybody else has. Oh, there. Oh, we've got a question from Shan. What are the dynamics of your occupational health team? i.e., how many team members and roles, and also what's the head count of Gwynedd Council? I think the head count is about 6,000, 6,500.
Yeah.
Yeah, I think that's the head count. So Harv, I don't know whether you want to answer the question about the dynamics of your team.
Within our occupational health team, we've got 6 staff members. We've got, I need to think now, we've got an admin, I'm the senior occupational health officer, and all the rest are occupational health advisors. Yeah.
Are you all IOSH members?
I'm not, no.
Oh, right, okay.
Most of the health and safety team is though, Nick, so you know.
And I would add, no matter where you work, and no matter whether the occupational health is in-house or external, I'd say it's important to have a good working relationship between health and safety and occupational health, because there is an overlap in the work and a bit of back and forth. And I think it works well for us that both teams basically have the same senior manager, although different team leads. So I've got Harv and Gail as both the team leads. So I think personally it works very well, and it's handy to be able to kind of call back and forth on different issues to try and sort out the best thing for the staff and the managers, really.
Great, that's sort of, I think that was my first question, was overlap, wasn't it? I think so. We've come full circle. So thank you very much for that. And I'd like to say a big thank you to Harv for a very interesting talk and for putting her head above the parapet and exposing herself to these questions. Thank you very much for that.
Thanks for having me.
Thank you to Paul for keeping us on track, and thank you to Gail and Gwennon for assisting us in Q&A, and also for arranging Harv to come and speak to us today. So, but I'd like to say a big diolch yn fawr to you all for attending today. Please hold the line if you're wanting to ask us on the committee any questions or anything about IOSH business, and we'll use it as a networking facility as well with other members if you like. So that just leaves me to wish you all on behalf of North Wales branch yn Nadolig Llawen blwyddyn iach gan bawb y tîm yma i chi gyd. So see you next year. Please complete the feedback forms when it comes out from Paul, and because when you receive them and send them back, it helps our committee to plan the ongoing programme. So enjoy the rest of your day, and unless you've got anything else to add, Paul,